Here comes another fancy menopause issue that we're going to talk about. So we've heard about perimenopause, menopause, and also the genitourinary syndrome of menopause. The new trending word or novel word is musculoskeletal syndrome of menopause or perimenopause. What exactly it is? Oh, this is not rocket science. So it's just muscle aches and pains, joint aches and pains that has always been there associated with menopause and perimenopause. Why does it happen? Because of the lack of estrogen, which is one of the anti-inflammatory agents that's naturally occurring in a woman's body. But when that content goes down, obviously the woman can experience this. Associated with this, because of the changes that the woman undergoes during perimenopause and menopause. So during perimenopause and menopause, almost there's 10% bone loss every year and 0.6% muscle mass loss in every year. So that's really important. It plays a significant role in the ongoing maintenance of your health. Now, you may go visit your GP or your own healthcare provider and say, oh my God, I've got this joint pain, I've got this muscle pain, I just can't move my shoulder, I can't bend my knee, or I can't bend my fingers. You might undergo all the expensive fancy tests that are available, ultrasound, CT, MRI, everything can come back normal. What happens? There may not be any underlying structural damage, but because of these changes that your body is undergoing during the perimenopause and menopause, you may experience these muscle aches and pains and joint aches and pains. So it's really important that you understand the difference between this pathophysiology and an actual damage if it has occurred to your joint. As I mentioned earlier, there could be 10% bone loss when the woman is going through perimenopause. But there are times when that bone loss may be accelerated. So how do we figure out if that is something that's happening to you? There is a test called bone mineral density testing. So that can determine if there is a minimal bone loss or if there is a bone loss that needs urgent attention. So the conditions are called osteopenia or osteoporosis. So definitely go and speak to your healthcare professional to see if this is something that you need to have organized. Now, some of the other things that you can do are resistance strength training, taking some vitamin D supplements, or of course, what is free is sunlight. So please, again, use your judgment and go and get some sunlight to help with your vitamin D production, and also vitamin K. But once you get diagnosed with either osteopenia or osteoporosis, there are bone mineral density increasing medications that may be prescribed to you. Now, if these musculoskeletal symptoms are a part of your overall symptoms of perimenopause or menopause, and if management is being discussed, then hormone replacement therapy is an option that is available to you. Again, please go read up on it, but that is an option that is available to you. You can speak to your own healthcare provider. How do you look after yourself? As always, eating healthy, exercising never goes out of fashion, and nowadays people do realize that muscle acts actually as an organ that helps control your blood sugar even. So it's really important that you look after your muscle mass so you can live an active, healthy, good quality of life even through your menopause. So if this is something that you're struggling with, speak to your own healthcare provider, or you can visit us at athenawomensclinic.com.au to make an appointment and have a little chat about this to us. But definitely don't forget eating healthy, exercising to keep your muscle mass and your joints intact. Good luck with this journey. I'm Dr. Kavipriya Soma, GP with special interest in women's health. All the best for everything.